previous cesarean section with fetal distress. I am showing the PG technique of the cesarean section. Now I am going to make the incision on the skin, and you see the previous scar line. This is the fine steel incision. Just I am giving the incision on the same line, and I am going to remove the scar also, so that patient will have not more than one scar. I have removed the previous scar by the hole, and I am going to open the peritoneal cavity by the pottery. Yes. I am cutting the rectus sheath now. This is the real unedited video. There is some additions of the previous cesarean. adhesions between the two rectors. Now peritoneal cavity is now open. So just stretch. Okay. I am now going to retract the bladder, and you see the previous adhesions of the peritoneum. Now I will cut these adhesions. Bladder is adherent up to some extent, but I am separating by the sharp dissection. There is some bleeding. Now you see the scar, previous scar. So I will give the incision on the previous scar. Probably baby's meconium is strained. You see, this is the membrane, bag of membrane, and yellow is in color. Probably you have to make the incision at every level 10 centimeter. Here, you see, this is meconium. I have already told you that yes, baby is crying. Baby is absolutely all right. Now I'm handing over the baby. Now I'm going to separate the placenta. 2 ampoules into now has been given. IM. Complete membrane is now separated. You see, uterus is all right. I'm going to externalize the uterus so that it will help me in stitching the uterus. I'm going to cover the uterus. You see. Clean the uterine cavity. Now I am holding the margins. This is the angle, and you see there is some extension at this end, but not more. You can use green armitage at this for holding the bleeders in the margin. Yes, but now it is quite clear. I stitch uterus in 2 layers. Yes, out करो. बीच इसको भी छोड़, इसको सेक्शन करो, you are hearing the sound crying of baby also. Baby is all right, although there is a meconium, but baby is all right. Okay, you see I am taking whole of the thickness, not whole thickness but 2/3. The aim, because I have to stitch it in the 2 layer, so the first layer I will left some portion, some thickness, so that it will be easy in taking the second layer. This video is just for the beginners in the field of the gynecology, and you can learn by seeing this video, and if you go through the book you really understand what it is. You see there is a bleeder. You know, in the myometrium the bleeders are not in a regular fashion, they are in the crisscross fashion. And just see, I'm just seeing, is there bleeding in the uterine cavity? Almost uterine cavity is, there is no bleeding inside. You should not be hurry in doing the cesarean section. You should take your own time, because patient never asks in how much time you have completed my cesarean. So do meticulously. Yes, you will cut through because of the fault. See, this is the angle. There is some part of membrane. You know, I have taken one bite because this bladder is high up and at here, so at this end bladder is adherent, so I will just remove the bladder. I will just separate the bladder by the fine dissection. You see how. Signing membrane between the bladder and the uterus, you see the signing membrane, so we should separate by the sharp dissection. Now it is clear. I'm just doing step by step for the beginners, so the beginners can learn how to separate the bladder. And now this is the myometrium, and by just separating this, by just separating the bladder, there is no chance of sometimes VVF may develop if you stitch the bladder. Okay, so you should be systematic because cesarean is a very easy procedure, but sometimes it may be very difficult if you do some wrong thing, and especially for the patients have to bear all your fault. So for the sake of the patient, you should be very careful. And nowadays a lot of litigations is filed against the doctors, so you should, I think you all are aware. But one thing I would like to mention, if you are faithful for your patient, 99% of the patient will be fine and you will be rewarded. Your patient will thank you by heart. So here now you see angle is, now this is the angle. If you have any problem, you can ask on my site. If I will get time, I will reply. Do section. Okay, now I have completed one layer, and we stitch the uterus in the two layer. At some places people are doing in one layer. Both are equally effective, but what I learned during my PG, since then I am stitching the uterus in two layer, and I feel confident after stitching in two layer. So I am going to stitch in two layer. You can choose your own way. In surgery there is no hard and fast rule. You can do with your own age, and you should take your own time. क्या नाम है आपका? उषा। कोई परेशानी आपको? ठंडा लग रहा है? अच्छा, एनेस्थेटिस्ट will take care of her chills. Okay, I'm now starting the second layer. Before starting the second layer, I am just giving the hinge amount. Suction. Continuous there. Section. The purpose of the second layer is just to invaginate the first layer, so that there will be no raw area and there is no chance of adhesions, and so you can easily open in the next cesarean section. small hematoma here. I will take in my bite, so this will be fine. Cut. Okay, now I have completed the uterus. I have stitched the uterus in 2 layers, and you see there is no, so there is one bleeding here, so I will take one extra bite. As I have already told you, there is no regular fashions of the blood vessels in the uterus, so you are free to take a bite anywhere, everywhere. Cut. Now you see there is some bleeding here. There is some vessels. One vessel, I have pricked one vessel that is bleeding now, so I will just take another bite. This one threaded. Because bleeding is here, there is a hematoma formation, so I am taking whole of the hematoma in one time. Should be aware, because this is not so uncommon, this is very common formation of the hematoma. See also the posterior surface is fine. Still bleeding. No bleeding now. You see, uterus is well contracted. There is no bleeding. Now I'm going to see the posterior surface. There is no bleeding. Suction. see, there is no bleeding. Uterus is absolutely all right. I am cleaning from the paracolligator because sometimes that is the dependent area in the lithotomy and the spine position. Yes, now I close the. I usually not close the visceral peritoneum, so I just close the parietal peritoneum and then the rectus seat. Then I close the abdomen.